Alright, this is my nutritional case presentation based on my patient in DH30A. So during this presentation, I'll be discussing the medical history background of the patient, their activity level, and the patient's goals, the anticipated goal for the patient, the need for nutritional counseling, the nutritional analysis of the patient's diet, how my findings incorporated to their oral health, materials I provided to the patient, clinical findings and correlations seen clinically, and then the desirable and undesirable practices of the patient and behavioral changes that they are willing to make, and then a conclusion. So first I'll go over the medical history background of the patient. So the patient is a 72-year-old Caucasian male. He's retired and travels for extended periods of time. This patient is diagnosed with hypertension, type 2 diabetes, and high cholesterol. He has 2 total knee replacements, and he has a family history of psychological conditions, type 2 diabetes, and cancer. The patient does not use tobacco or consume any alcohol. So the patient is taking over 10 medications to treat and manage their health. They're taking Flomax, Metformin, Cozar, CoQ10, Lipitor, Quercetin, low-dose aspirin, Tylenol PM, vitamin B12, D3, C, and zinc sulfate, and they're also taking 2 grams amoxicillin before each appointment due to their two total knee replacements. So the patient's oral health status is fair due to only brushing 1 time per day. They have no history of periodontal treatment. They're an ADA case type 2 with an AAP of mild periodontitis, stage 1, grade B. And the patient reports that they dislike vegetables and they like to consume meats, pasta, salads, eggs, and bread. So the activity level and the patient goals. The patient reports being moderately active. They walk on average 2.6 miles per day. And then the patient's goals are to lose weight. So the anticipated goal I have for the patient. So I would like for them to maintain and improve their hypertension, cholesterol levels, and type 2 diabetes. They should decrease their sodium intake to help manage their hypertension, decrease their cholesterol intake, and then manage their glucose levels by limiting the intake. And then this will also decrease the patient's risk for caries. So the need for nutritional counseling. The patient does have pre-existing conditions that can be managed by dietary changes. The patient is at high risk for caries and has 3 or more active caries. The patient travels often and has to go out to eat frequently. I feel the patient would benefit from nutritional counseling in order to help make dietary choices when food options are limited. So this is the nutritional analysis. So the patient didn't really have any omissions to their food diary. They're very thorough with their entries. The patient is on vacation for more than half of the year, so the vacation diet is the regular diet, and this consists of eating out and convenience foods. So the patient consumed this amount of nutrients for the 3 days. So then I will incorporate my findings. So the patient was deficient in several areas. They were also in excess in the daily calories, protein, saturated fats, sodium, and sugar. This is concerning since the patient is diagnosed with type 2 diabetes, hypertension, and high cholesterol. So for the food group worksheet, we could see that they were in excess of their daily caloric intake. They were adequate with grains. In vegetables, fruits, and milk, we could see that they're deficient, and they are in excess of protein foods, saturated fats, sodium, and sugar. We could see that they were had a sum of 10 liquid exposures, and then they had a sum of 20 solid exposures to cariogenic foods. And so on average, they had 333 minutes daily of acid exposure. And then here's the material that I provided for the patient. So I provided the patient with a handout of topics I discussed while doing their nutritional counseling. This handout included foods that could increase their risk for decay and ways that they can combat or limit their exposure. The handout also listed some vegetables that are known to reduce cholesterol levels. Since the patient reports that they don't like to consume vegetables, I just wanted to inform them on how consuming more vegetables would help with their systemic health. Then I also provided the patient with an example diet that they could implement. So clinical findings and correlations. The patient consumed a variety of carcinogenic foods. This included orange juice, sugary cereals, coffee creamers, soda, jelly beans, toast, jam, sauces, cookies, chips, and bananas. There's caries risk. The patient is at high caries risk due to abnormal dental anatomy and the presence of 3 or more carious lesions. The patient self-reported that they do not consume sugary beverages between meals typically. So the patient has 3 or more new caries in the past year. This is attributed to their diet, which consists of numerous carcinogenic foods. They also consume a diet high in sugar, which further contributes to their caries risk. And clinically, the patient has several areas of erosion and abrasion. This is especially visible on the anterior teeth. So we could see, based on the caries risk assessment, they were at low risk for a variety of categories. They were at a medium risk for medications that reduce salivary flow, visible plaque, unusual tooth morphology, interproximal restorations, and exposed root surfaces due to recession. And they're at a high risk because they have 3 or more carious lesions in the past 36 months. So my recommendation was to increase brushing to 2 times a day as compared to 1 time per day, and they should use a sodium fluoride toothpaste and with a soft bristle toothbrush, and they should increase their flossing to 4 to 6 times per week and eventually to daily. And then desirable and undesirable practices. So the patient consumes several carcinogenic foods and doesn't follow a well-balanced diet. And so they consume a diet high in sugars, fats, sodium, and proteins, and they were inadequate in vegetables, fruits, and dairy products. So the patient has made an attempt to consume a variety of foods during this diary, and I could see that they had consumed each nutrient at least 1 throughout the day with the exception of fruit. So behavioral changes. During the counseling, the patient reported that they were unaware of the amount of sodium they were consuming, and the patient was actually shocked to see the excess they consumed of sodium, fat, and sugars. So they had reported that their physician had spoken with them about making dietary modifications to best manage their systemic conditions, and they thought that they were somewhat following their recommendations, and so they were really shocked to see how much of an excess they were on sodium levels. And so I encouraged the patient to make a behavioral change by informing the patient on how nutrition is contributing to their risk of tooth decay, diabetes, hypertension, and high cholesterol. And they are on numerous medications to manage these conditions. If they make dietary changes, their physician may decrease the number of prescribed medications the patient is needing to take to manage their condition. So I recommended that the patient limits the amount of sugar they consume by resorting to sugar-free coffee creamers and limiting the amount of sugary snacks they consume. I also recommended that they log their food into the MyPlate app in order to monitor their sodium intake and to understand how much sodium is in each food item. And so at the follow-up appointment, the patient reported that they had adopted some of the changes, such as using sugar-free products and reducing sodium products, and they were not that interested in using the app and only logged their food for 1 day. So conclusion, overall, I feel like the patient has a better understanding of their diet and how it contributes to their dental and systemic health. They're in preparation stage of making changes to their dietary style, but they are not implementing these changes as of yet. So at the end of the counseling, they were able to recall the information that I was telling them in order to make changes to their diet on their own. Thanks.